Hi everyone, welcome to 𝗲𝗵𝗵𝗵. Myself Dr. Perv and I welcome you to the class of pediatrics. In this pediatrics class, the most important thing of entire pediatrics, the classification of cyanotic and acyanotic diseases, this is going to be the topic of discussion. So, I am telling that we are discussing the pediatric cardiology, and in pediatric cardiology, this is going to be the class where we will be discussing the differences between the cyanotic and the acyanotic defects. So, cyanotic means, of course, why cyanosis is happening, because we have discussed in the class of neonatology that cyanosis means that there is a bluish discoloration of the skin. Why? Because of increase in amount of reduced hemoglobin. Why? And why this reduced hemoglobin is increased? Because of course the oxygen amount is less. Okay. So my dear friends, please understand that cyanosis develops whenever there is a compromise in the pulmonary blood flow. Because if the pulmonary blood flow is less, oxygenation will be less, reduction of hemoglobin will be more, and there will be cyanosis. Okay. So this you have to understand. And why? What are the reasons why there will be reduced blood flow, reduced pulmonary blood flow? Because, for example, this is the heart, and if I divide it into two parts, okay, let me just, yeah. So this is the, of course, the right part, this is the left part, and the pulmonary artery is this is going to the lungs. And you have to understand that if there is any problem that is causing less blood on the right side, of course the pulmonary artery will get less blood. For example, in some conditions we have got a right to left shunt. Okay, so right to left shunt, if it is there, or there is obstruction in the pulmonary circulation, everything what is going to happen, that leads to cyanosis. Okay, that leads to what? Cyanosis. And I think I have told you in the first class only that all the cyanotic heart disease start with the T letter, plus one is going to be there, that is called as Epstein's anomaly. So I think now it is easy for you to remember that every C is going to start with the T. So Truncus arteriosus, transposition of great vessels, tricuspid atresia, tetralogy of Fallot, then total anomalous pulmonary venous return, hypoplastic left heart syndrome. So hypoplastic left heart syndrome is also one of the causes which is responsible for cyanotic heart disease. Okay, and all the other diseases are atrial septal defect, ventricular septal defect, patent ductus arteriosus, coarctation of aorta, endocardial cushion defect. All these are the acyanotic defects. So why there is acyanosis, there is no cyanosis? Because of course the pulmonary circulation is maintained. These develop if there is an obstruction to the systemic circulation, or there is a left to right shunt. There is a left to right shunt. Of course, for example, if I talk for atrial septal defect, okay, let me just make the heart once again. If I talk for the atrial septal defect, you know that the left side musculature is of course more strong. Why? Because it has to supply the blood to the entire body. So left side musculature is strong. So if there is a ASD, entire blood is going to go from left side to the right side. Less blood will be reaching to the organs, of course, but there is no cyanosis because there is enough amount of oxygen which is there. Although the total blood reaching the tissue, perfusing the tissues is less, but then there is no cyanosis because there is no reduced hemoglobin, because the amount of oxygen is normal. Okay, so remember this is important. And now onset and presentation. So please understand that these cyanotic heart diseases are having a very very early onset. If they are presenting in the first 3 days. Okay, and this is the cyanosis which is not responsive to oxygen. Why? Because any amount of oxygen you give, because the perfusion is not good, because the oxygen is not even going to the pulmonary arteries, to the circulation, to the blood. Of course this cyanosis is unresponsive to the oxygen, right? Whereas if you see for acyanotic heart diseases, acyanotic heart disease mostly occurs when mostly manifests whenever there is a high demand. Okay, for example, if the child is feeding, so of course more blood is required, so the child will develop sweating, will develop respiratory distress like that. And in older children, whenever they'll perform exercise, they'll be intolerant. There will be exercise intolerance which is going to be happening. Now, yes, cyanotic heart diseases are PDA dependent. What is PDA? It is not public display. It is the patent ductus arteriosus. So, what is patent ductus arteriosus? So, see, this is the heart and this is the pulmonary artery and this is going to be aorta. Okay. So, there is a connection between the two, embryological connection between the two. Why? Because what happens in the early infancy, not in the infancy, I should say, in the fetal life, there is no need of pulmonary circulation because the lungs are not developed. So, all the blood which enters here is going to transfer to the aorta. Okay, is going to get transferred into aorta. Okay. So, what happens when a child is having a cyanotic heart disease? Okay. So, in cyanotic heart disease, I have told you that the blood supply is not going to the lungs. Now, for example, if there is this ductus arteriosus is patent, if it is patent ductus arteriosus, so what is going to happen? Most of the blood is going from the pulmonary artery to the aorta, alright, in the fetal life. But once the lungs are developed properly, there is going to be a negative pressure which is going to be there in the pulmonary arteries, and of course the aorta will have a positive pressure because a lot of blood is going into the aorta. So, the blood should start going from the aorta to the pulmonary artery. Okay. The blood will start going from the aorta into the pulmonary artery. So, if the obstruction is here and the patent ductus arteriosus is beyond the level of the obstruction, of course, the aorta can transfer the blood into pulmonary artery, and once it is going into the pulmonary artery, it is going to get oxygenated and cyanosis will not be there. So, PDA is something that is very good. It is very, 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 very good for what? For the people who are having cyanotic heart disease. So, why it is there? Understand. If PDA is there, PDA means patent ductus arteriosus. Now, ductus arteriosus, of course, is a duct which is there in what? In the fetal life. But if it is patent in the infants, then what is going to happen? The blood is going to go from aorta because it is at a higher pressure to the pulmonary artery, and from the pulmonary artery they can go to the lungs and they can get oxygenated. So, there will be no cyanosis which will be there. You getting it? That's good. So, how will you diagnose it? Of course, for both of the condition, for both the groups, echo is the most important part for the diagnosis. Now, what is Eisenmengerization syndrome? This is extremely important. So, Eisenmengerization syndrome means there is a shunt reversal. There is a shunt reversal. Now, for example, in ASD, I told you what normally happens is from left side, the blood has to go to right side. But a condition, a stage will come where there will be a lot of blood on the right side and less blood will be there on the left side. Even if the musculature is strong, the circulation will be from right side to the left side. And I have told you that if the right side is getting less amount of blood, of course, there will be cyanosis which will be happening. This reversal of the shunt is called as Eisenmengerization. So, what is Eisenmengerization? I told you, for example, in ASD, the left-sided blood was going to the right side normally because left side is having a good musculature. That's why from left side it was going to the right side. But now what happens is the amount of blood is very high on the right side, and because the amount of blood is very high on the right side, it will start diverting the blood flow to the left side. And once the blood flow is diverted from the right side to the left side will have less blood, and if there is less blood on the right side, less blood will be going to the pulmonary circulation that causes cyanosis. This is called as Eisenmengerization. Now, more blood is going to the left side, my dear friends. Okay. So, heart thinks as if heart is not able to pump the blood to the pulmonary circulation. Are you getting it? So, the thing is, the blood is not there on right side, but the heart thinks, oh my god, it seems that I am not able to pump enough amount of blood. So right side of heart start pumping, so that even if less blood is there, it should reach to the lungs. That's why the right ventricle will show hypertrophy. That's why the pulmonary artery, because a lot of pressure is coming from behind, although blood is less, but the pressure is more, and the high pressure in any circulation is called as hypertension, my dear friends. So there will be pulmonary hypertension, there will be right ventricular hypertrophy, and there will be cyanosis when there is Eisenmingerization syndrome. Okay, so I think now the things are very much clear to you. If at all you have any doubt, I can repost another video making the concepts even more simpler for you. Thank you so much. If you like this video, I expect feedback from your side.